Chari Cohen, who's president of the Hepatitis B Foundation. She's also co-chair of the Hepatitis B United Coalition here in the United States, and has been working on hepatitis B related issues for patients living with hepatitis B for many years, and look forward to her thoughts on public health perspectives and patient perspectives as we look for options for functional cures for hepatitis B. Chari?
Thank you so much, John. Thanks for having me today. And I want to thank all the expert presenters and also Dr. Koshy, who we will greatly miss having you, especially at our International HBV meeting every year. So I'm going to switch it up and talk a little bit about new therapies for hepatitis B from the public health and patient community perspective. Next slide, please. We've heard from expert presenters today on some of the scientific challenges and innovations towards future therapies. And we've heard for many years, we've all been working in the Hep B space for a long time. And in the early 2000s, what we heard was, well, why do we need antivirals for hepatitis B? We have a vaccine. And now what we hear is, why do we need better treatments for hepatitis B? We have antivirals. And I think we've heard very convincing arguments from a scientific perspective about why we need better therapies for the future of hepatitis B. And I'm going to talk a little bit about the challenges and thoughts of people with lived experience. Next slide, please. The data I'm going to share today, we've been collecting since 2019. Primarily, I'm sharing data from a 2020 to 2021 survey. We had about 1,900 individuals participate in the survey, about 1,600 outside the US, 300 inside the US. About 50% of the folks who responded to the survey were on treatment, and about 50% had been diagnosed for more than 10 years. We also, I'm going to share some data that was triangulated from about 150 in-depth interviews and focus groups with about 150 people over the same years. So what we hear, what does it look like to live with chronic hepatitis B infection? We hear about unrelenting, often debilitating chronic fatigue, joint pain, and muscle aches. And these physical symptoms impact productivity, ability to care for family, ability to have a professional life, ability to work, socialize, and attend to necessary tasks. We also hear about somewhat debilitating anxiety and fear and stress, and this is primarily worry about liver cancer and premature death, but also anxiety about being able to afford long-term access and treatment, and anxiety about transmitting to others. We also hear quite a lot about how chronic hepatitis B decreases social interaction and leads to self-isolation and also external isolation. And so this, depending on where people are in their lives, can impact dating and finding a partner, can impact having children. People often are worried or are rejected by family, friends, and coworkers. And we see quite a lot of mental health impact here. Moving on to stigma and discrimination, I think we all have heard the stories of this, but we're also documenting how surface antigen positivity actually leads to sanctioned discrimination in many areas of the world, where people are unable to go to school, unable to get jobs, and unable to immigrate to certain countries. And then, of course, associated with the stigma and shame, and what we hear quite a lot is that people are internalizing that stigma and shame and feel like they're blaming, that they're at blame for hepatitis B infection of themselves and potentially even transmitting to others. And so you can see there's a tremendous impact of living with chronic hepatitis B. Next slide. And this is just a little bit, and you can see that this has been published in a few papers, but to just put a few numbers on it, we created some indices from the 2020 survey, and we created a physical impact, social impact, and worry impact index. And you can see most of the people who responded are greatly physically impacted, but also socially and sort of from anxiety perspectives are impacted as well. We can also see, if you look at the data, that treatment with current antivirals was strongly associated with improvement in all of these indices. However, and I'm going to show you a little bit later, where there was still some residual negative impact. Next slide, please. So currently, there are multiple reasons that people want to take current antiviral treatment, right? So they feel as though they don't have to avoid others, they feel less stigma or less shame, they feel less physical symptoms. However, one of the things that came through from the data was that even when people are on treatment, there are residual quality of life impacts. People know that their liver cancer rate, that their risk of liver cancer does not go down to zero. They know that they can still have, even on antiviral treatment, can still progress. They know that they can potentially still transmit. And there are other considerable treatment challenges, such as cost, side effects, and burden of taking a pill every day for many years. And then I also wanted to quickly just mention that there are many people in the world who do not meet criteria, but based on many of the different professional society guidelines for current treatment. And those folks are either, what we see from the data is they're either leaving, right? So they're not adhering to follow-up because they're not taking any treatment, or they're trying to find other alternatives to do something positive to manage their hepatitis B. Next slide. So what do people want for future hepatitis B treatment? Next slide, please. Above all, what people want is finite duration therapy that will help them achieve and sustain undetectable levels of surface antigen and undetectable levels of hepatitis B DNA. And they also want to be able to significantly reduce the risk of cirrhosis, liver failure, and liver cancer. And what we hear from people is they want to know that their risk of liver cancer is not necessarily any greater than a person without hepatitis B, and certainly want greater risk reduction than they have today. And then also want to see improved quality of life and an end to stigma and discrimination. And you'll see in a little bit, we're going to talk more about how these things are all intertwined together. Next slide. And this is where we get into some of the details about what people want from future treatment. And you can see on the left, the graph, this is a combination of international and US data. So we asked people to rank their number one reason, their number one wanted outcome for future treatment. And across the board, it was loss of surface antigen internationally. So the top three were they wanted loss of surface antigen, they want to be able to stop medication after 6 to 12 months, so finite duration of therapy, and they want decreased risk of liver cancer. But then if you break it down into the US versus international, you can see a couple differences here. So in the US, decreased risk of liver cancer was the number one wanted outcome for future therapy. Internationally, it's loss of surface antigen. Although if you look, the top three are all the same. The toggles are a little bit different here. And the loss of surface antigen internationally is, of course, intertwined with the fact that surface antigen is what leads to stigma and discrimination. So when people can't get married, when people lose their place in their family, when people can't get jobs and can't immigrate, it is that surface antigen, and that is why loss of surface antigen is so important, especially among people who live in low and middle income countries and are facing discrimination. Next slide. So we can see here that discrimination is certainly a challenge for people with chronic hepatitis B infection, especially in low and middle income countries. We have started a discrimination registry a couple years ago. We've already had almost 600 people complete the registry from about 65 countries. Primarily, we're seeing employment discrimination, but also immigration and education discrimination, as well as healthcare. And this is where functional cure leading to surface antigen loss will play a critical role. However, it also means that we have a challenge now we are being challenged to find a way to change policies in the absence of functional cure. It's great to see new clinical trials coming out that have possibility for functional cure. It's great to see these new innovations, but in the meantime, we need to find a way to make use of the current vaccines and current treatments that we have now so that we can end policy that is discriminatory among people around the world. Next slide. So what do we need? Just to sum up a little bit in terms of future therapeutics for hepatitis B, people want more treatment options. Right now, we know we have interferon, and then we have 2 antivirals, and it's primarily the 2 antivirals that are being used and accessed around the world when treatment is accessible at all. That's not much choice. If you look and try and compare to some other chronic illnesses that are treated with antivirals, there are many choices for antiviral treatments, not just 2. So we need more treatment options better DAAs. We also need more treatment modalities. And I know that there's a lot of excitement in the long-acting antiviral space. And we are actually currently doing a survey right now globally, asking people how they feel with hepatitis B, how they would feel about long-acting antivirals. That could be, that could really help to decrease many of the challenges associated with long-term treatment. Of course, the gold standard would be a cure or functional cure. But then underlying all of it, we need people to have access to affordable and sustainable care and treatment. How do we get there? One of the things that I just wanted to point out today was that, we've seen presentations today in terms of some excellent innovations that could lead to better therapeutics or functional cure. However, over the last 5 years, we've also seen the hepatitis B research space get smaller. First, it got bigger. Now it's getting smaller. We've lost major companies. We've lost small companies just in the past few years and few months. So every time we lose scientists and researchers working in hepatitis B, we lose potential therapeutics for the future. And so we need more funding and prioritization for hepatitis B therapeutics research, and we need more opportunities for emerging scientists to stay in the field. And that, I think, is going to be very important for future therapies for Hep B. Next slide. We also need to make sure that we are meaningfully including the patient community and the people who have lived experience with hepatitis B and the public health community into the preclinical and clinical therapeutic space. We need to make sure that people who have lived experience are included as partners and experts, whether it's in development of treatment guidelines, whether it's in development and implementation of public health programs, or whether it's in preclinical or clinical research, things like design of clinical trials, feedback on clinical trials as well. We want to make sure that patients and the patient community are actually meaningfully represented, not just ticking boxes. And that means working with a number of advocates around the world through community advisory boards, through nonprofit and community organizations who work with, just at the Hepatitis B Foundation, we work with a few thousand people living with hepatitis B. And there actually are community organizations working around the world who have access to people with lived experience, and folks with lived experience are ready, willing, and excited to come to the table as partners. Next slide. And the WHO, they have a blueprint for this, and so this is from the Global Health Sector Strategy on HIV, viral hepatitis, and STIs. And here it clearly says that in the scientific and clinical community, we should be engaging and supporting people who have viral hepatitis. We need to be doing this around the world, making sure that low and middle income countries and people who are disenfranchised, communities who are disenfranchised, are at the table. Not only will that help to improve uptake of future treatments, it will ensure that people who are highly impacted and communities that are highly impacted will benefit. So from a health equity perspective, we need to make sure that civil society is engaged around the world as we look for new therapeutics. Next slide. I wanted to just end with not me, but the voices of people who are living with hepatitis B. And as you know, July 28th, which was just last week, is World Hepatitis Day. And we have celebrated World Hepatitis Day globally for many years. Last year, we had a declaration published from people living with hepatitis B. And I think we have a very, very short video that we are going to show so that we can hear from folks themselves about what it is they're looking for.
You get that.
We want to live healthy and long lives. Care, medication, and liver cancer screening, or our lives may be cut short.
We want to live to our fullest potential, but our personal and professional lives are often limited by stigma and discrimination. We need social support, increased awareness, and removal of any discriminatory laws and practices.
We want our doctors to consider the overall impact of hepatitis B and hepatitis delta on our lives and consider outcomes that are important to us.
We want to be at the center of decision making for our care, with our preferences and values prioritized.
Every year we wait, more of us needlessly lose their lives. We desperately need hepatitis B prioritized, and the time is now.
Thanks so much, Lindsay. And I think that's it for me. So John, I will hand it back over to you. Just one quick, I think I have a last slide in case anyone is interested. On September 11th, we are at the International HBV meeting in Chicago. We are hosting a community forum where we will be hearing from a panel of people who have lived experience and also some of the US experts to talk about progress towards elimination in the US. Thank you.
Thank you very much. It's a great way to end this program, Chari, because it's really at the end of the day, we're really all about helping people with hepatitis B, and this is a call to action that we all share.